So the process that we've been using for zoonotic influenza and for other zoonotic disease risk assessments has evolved and developed over the years. And now it's very strongly based on the WHO Rapid Risk Assessment Guidance that was released in 2012, where we base the risk assessment on what we call risk questions. And we evaluate exposure, we evaluate the hazard, and we very much evaluate the context in which the event is happening. We also assign a likelihood, an impact, and an uncertainty for each of our risk estimates for each of our risk questions. And we've also, very importantly, provided justification for each of our risk estimates for each of our risk questions. Mostly for our zoonotic influenza risk assessments, we also post a summary of our risk assessment on the web. We have been doing this for influenza now for very many years, and this is a standardized process now, and every month a summary is posted on the web for zoonotic influenza that provides an assessment for each of the influenza viruses that's circulating, either in animals that pose a risk or for humans that have already been infected with a subtype. Another thing that's very important about these risk assessments, not only do we come up with some kind of estimate of risk, but going through the risk assessment process allows us to identify data gaps. Very, very often with these events, especially at the beginning, there are huge gaps in our knowledge. We have no information on surveillance and distribution of the virus, or sometimes even what specific subtype this virus is. And we recognize that to do a risk assessment, we don't need all of the information right then and there, but identifying what we do need to make a better risk assessment, a better estimate with less uncertainty will be optimal. And we do risk assessments, as I said, every month for zoonotic influenza, so we can gather the information during the month and then use it for the next iteration to have a better assessment.